Hello, Assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel, that is Dr. Jahangir Khan. Well, I have started the videos on a chest X-ray, and this is my third video on chest X-ray. The first video was on the preliminaries for the chest X-ray. That was a RIPE criteria: rotation, inspiration, penetration, and exposure. The second video was on how to explain the pathology, how to explain the lesion on a chest X-ray, and how to explain the size, the shape of the pathology, and the location of pathology. And I already discussed in the second video the differential diagnosis based on location of lesion. And this is the third video. Today we will talk about what are the hidden areas for which you should look into the chest X-ray. If you are having a chest X-ray, what are the hidden areas you must look in order not to miss the major pathology? So these hidden areas are: number one, you are having the costophrenic angle, you are having the cardiophrenic angle, the costophrenic angle and the cardiophrenic angles, and you are having the apices, So from now onwards, if you are going to see an X-ray, you must look for these hidden areas. Well, most of the time we miss all those pathologies. Well, here I would like to mention one thing, that is how much fluid is required to blunt the costophrenic angle. That is, how much fluid is required to blunt the costophrenic angle. The answer is, it depends upon the chest X-ray. If that is the PA view like this one, that needs 200 to 300 ml of the fluid is required. Some book says 150 to 200 of the pleural fluid is at least required to blunt that angle in a PA film, while in a lateral film that is almost 50 to 75 ml of pleural fluid is required to blunt that angle. On ultrasound, that is less than 50 ml. Less than 50 ml is detected on ultrasound. So we must look for the costophrenic angle, that is the hidden area. We must look for the cardiophrenic angle. Most of the time the pathology lies here. And we must look for the apices. Now if you see the chest X-ray, this looks clear, but if you focus on the hidden areas, can you see this opacity? This is apical opacity. This patient is having fever for the last 4 months, and the patient is having weight loss, the patient is having chronic cough and night sweats, and there was increased sputum. Sputum for FB was positive. So this is a case of TB, tuberculosis. Patient was treated and responded very well. Hidden area, apical opacity, TB, apical opacity, pleural thickening. Also keep in mind that diagnosis also. Coming toward the next X-ray. Now, what is the abnormality in this chest X-ray? So you must look for the heart behind the heart. So looking into the hidden areas, can you see this heart? Usually on this side. So you are having a double right heart border, this border and this border. This is called double right heart border. This is seen in a case of mitral stenosis. What happens if this is your heart? You are having the right atrium, right ventricle, left atrium. The left atrium, this enlarges and produces a projection behind the right ventricle. Now you see this second border behind the first border. This is actually the left atrium that is dilated and coming behind the right ventricle. Normally the left atrium lies over here, but if it is going to be dilated, it goes beyond that point. So if you see the second heart, the second border, that is because of the dilatation of the left atrium. it comes to that area, and the diagnosis is the mitral stenosis. Diagnosis is mitral stenosis. Another condition in which you can see right heart double border is the collapse of the lung on this side, but with that you are having tracheal deviation toward the same side. So the lung collapse that produces an opacity next to the heart border, and you can see double heart, and but with that the trachea is deviated toward the same side. Coming next, now again looking into the hidden areas, what you see, gastrophenic angle. Now coming toward the cardiophrenic angle, what is this? The cardiophrenic angle, if you see this lesion, this is mostly pericardial cyst or lipoma or pericardial cyst most of the time. So the hidden area, they should not be missed. So what you see over here, can you see the air fluid level over here? This is above the air and you are having fluid below. What is this? Behind the heart, if you see the air fluid level, either this is esophagus or this is stomach. Esophagus, stomach. We know esophagus is having a linear shape, is having a vertical shape. So this is actually esophagus, and you are having obstruction right there. You are having obstruction over there, over here. So the fluid is not coming down, so there is dilatation, distension of the esophagus. So this is usually achalasia. This is achalasia or esophageal tumor. So it needs further investigation. Now, again you can see the air fluid level, but is it tubular? No. It's more dilated. This is a stomach. Can you differentiate between both these two? The previous and this one, that was in the central and that was linear, but this is circular, this is spherical. So what has the shape of this of the sphere? That is the stomach. This is a hiatal hernia. This is hiatal hernia. So air fluid level at the level of the heart, tubular, esophagus. This one, hiatal hernia, your stomach lies in the chest. So that's all for today. The topic was the hidden areas of the hidden areas on the chest X-ray you must look for. Thanks for watching and subscribe my channel if you have not subscribed till now. Press the bell icon so that you can get the notification of my new videos and share my channel. Thanks for watching.